Welcome to the Here's to Your Health podcast. I'm Jill Melby, and today we're talking with Sarah Gaul, the CCMH Certified Diabetes Care and Education Specialist. November is Diabetes Awareness Month, so we're glad to be talking with Sarah today about the Diabetes Management Program. Welcome, Sarah.
Thank you for having me.
Can you tell us a little bit about yourself and the program?
Well, I have been here at CCMH for about 11 years now, and I have worked with patients with diabetes for pretty much that entire time. But within the last year, I've really been able to we've kind of formalized our diabetes education program, and I've been able to devote almost 100% of my time up here on diabetes management with patients. So it's been a really exciting year with getting our program accredited by the CDCES organization and the state of Iowa. Last summer, we've just been able to really grow our program and offer our patients the best diabetes education services right here in Crawford County.
That's great to have that service in our county.
Yes.
Can you talk to us about how common is diabetes both nationally and in the local community?
Diabetes incidence here in Crawford County is actually higher than both the state and national averages. The CDC generally says that about 15% of adults, meaning over the age of 18, have diabetes in the United States. The state of Iowa is a little lower at 11%, but here in Crawford County, we're at about 21%. So almost 1 in 5 adults in Crawford County has diabetes. And of course, as the age gets older, that prevalence increases. Over age 65, it's about 1 in 3.
Oh, wow.
People actually have diabetes. So it's a very common and real diagnosis that patients are living with, and our providers here, are working with patients to manage.
Yeah, those are startling numbers almost.
They are.
For our county. What role does early detection play in managing or preventing the diabetes complications?
Early detection leads to early management, which has a significant impact in reducing long-term complications from diabetes. Over time, elevated blood sugars cause both large vessel problems, increasing risk for heart attack and stroke, and also small vessel disease. It can affect kidneys, it can affect eyes, and also peripheral nerves, which is like the nerves in our fingers and our toes. So left unchecked or unmanaged, people with diabetes run the higher risk of amputations, kidney disease, blindness, heart attack, and stroke. So it's not the diagnosis of diabetes necessarily that really increases that risk. It's when it's gone unmanaged, when your blood sugars remain high for a long period of time without proper management. And that's why we're here. Our goal is to help people with that diagnosis manage it well, live well with the diagnosis, and then really cut the risk of those complications long term.
Sure. So once they have that diagnosis, what does a typical care plan look like?
Here, if they have a diagnosis, our kind of approach is a combination of lifestyle management and medication management. With our program, there's kind of 7 areas of self-care that we focus on in our diabetes education program. First and foremost, healthy coping. How is each patient managing it? How are they coping with the disease and managing it? Being active, taking medications, healthy eating, monitoring. How are we monitoring how you're doing with your diabetes, with your numbers, testing for blood glucose, and then also reducing risks and preventing complications long term.
Great. What resources or what is the structure, of your diabetes management program offer to people?
So we can see anybody with a diabetes diagnosis can be seen by me. They can come in and get an appointment for diabetes education. It does require a physician order or a provider, whether that's a physician or a mid-level, like a nurse practitioner or physician assistant. So patients can either talk with their provider and say, hey, I feel like I would benefit from diabetes education, or if they want to contact me directly, I can work with their provider to get that referral.
Great. That's great to hear. So thank you for being on here today with me on the Here's to Your Health podcast, Sarah. We really appreciate your time.
Thank you very much.